This is Dr. Nadim and his wife Anum. He is a psychiatrist and his wife suffers from chronic mental illness. He hires Farah to help him take care of his dear wife. Farah took her job really seriously.
Until one day, Anum mentioned about Mona, her sister. As the story developed, it finally became apparent to audience. Mona is not the only one who suffers from mental illness. Her husband too.
What a twist of fate! Imagine, you have been having episodes of mental breakdowns and finally decided to get help, only to find out your psychiatrist himself is a mental patient.
It is important to note that mental illness is the second biggest health issue affecting Malaysians. It was reported that 1 in 3 Malaysians have mental health issues. Today, we are going to share about the Minnesota Multiphasic Personality Inventory (MMPI). It is a psychological test that assesses personality traits and psychopathology to test people who are suspected of having mental health or other clinical issues.
Let's look at the history of MMPI and how it has evolved. Here is the timeline. The MMPI dates back to 1937. It was developed by Stark R. Hathaway and J. Chanley McKinley. MMPI contains an inventory of true-false questions intended to assess different psychiatric conditions and their severity. It was first published in 1942 with 566 items to be assessed. This is almost a half of reduction from its initial prepared items, which was 1,100. In 1989, a team which was led by Yosef Ben Porath revised the inventory and introduced MMPI-2. The set of items later went through a series of revampments, which were in 2001, 2003, and 2009. The 2009 revised MMPI-2 is still in use until now. In 1992, the MMPI-A, which was targeted to adolescents aged 14 to 18, was published. It contained 478 questions. The Minnesota Multiphasic Personality Inventory 2 Restructured Form, or MMPI-2-RF, was published in 2008, containing only 338 true or false questions. In 2016, the Minnesota Multiphasic Personality Inventory Adolescent Restructured Form, or MMPI-A-RF, was published with the total items reduced to 241. The most current MMPI, that is MMPI-3, which was published in 2020 with 335 items, is targeted to respondents aged 18 and above.
The MMPI-2 and MMPI-A have 10 clinical scales that are used to indicate different psychological conditions.
Scale 1. Hypochondriasis. It is developed to identify people displaying the symptoms of hypochondria, or a tendency to believe that one has an undiagnosed medical condition, also known as illness anxiety disorder or health anxiety.
Scale 2. Depression. It is designed to identify depression characterized by poor morale, lack of hope in the future, and general dissatisfaction with one's own life situation. It is the most common mental disorder worldwide.
Scale 3. Hysteria. It is designed to identify those who display hysteria or physical complaints in stressful situations. Research shows that those who are well educated and of a high social class tend to score higher on this scale. Women also tend to score higher than men on this scale, according to Cherry 2022.
Scale 4. Psychopathic deviate. It is developed to identify psychopathic individuals. It measures social deviation, lack of acceptance of authority, and immorality. High scorers tend to be more rebellious, while low scorers are more accepting in authority. High scorers are usually diagnosed with a personality disorder rather than a psychotic disorder.
Scale 5. Masculinity, Femininity. It is designed to assess how rigidly an individual identifies with stereotypical male and female gender roles. Initially, it was designed by the original authors to identify homosexual tendencies, but it was ineffective.
Scale 6. Paranoia. It is developed to identify individuals with paranoid symptoms such as suspiciousness, feeling of discrimination, extreme self-concept, excessive sensitivity, and rigid attitude.
Scale 7. Psychasthenia. It is designed to measure excessive doubts, compulsions, obsessions, and unreasonable fears. This diagnostic label is no longer used today.
Scale 8. Schizophrenia. It is developed to identify individuals with schizophrenia, including strange thought process and abnormal perception. The scale can also show potential substance abuse, emotional or social isolation, strangeness, and a limited interest in other people.
Scale 9. Hypomania. It is developed to identify characteristics of hypomania, such as elevated mood, hallucinations, delusions of grandeur, accelerated speech and motor activity, irritability, flight of ideas, and brief periods of depression.
Scale 0. Social introversion. It is designed to assess a person's shyness and tendency to withdraw from social contact and responsibilities. It was developed later than the other 9 scales. Despite the name given to each scale, there are not pure measures since many conditions have overlapping symptoms. Because of this, most psychologists simply refer to each scale by number. The MMPI is most commonly used by mental health professionals to assess and diagnose mental illness. It helps to assess patients and aids in designing effective treatment strategies, especially for pain management. It can also be used for substance abuse programs, as it aids in evaluating participants and selecting suitable treatment approaches.
It has also been utilized outside the field of clinical psychology. The MMPI-2 is often used in legal cases as legal evidence in criminal and civil cases. Remember a case in 2021 when a Malaysian drug trafficker, Nagantiran, appealed for his death sentence. Experts reviewed his case and declared that he was not substantially mentally impaired. Hence, he was executed in 2021.
MMPI is also used by marriage and family counselors to provide insights for clients and for custody dispute in courtrooms.
Based on our research, we strongly believe that MMPI is appropriate to be utilized as a diagnostic test. According to Merriam-Webster.com, a diagnostic test refers to a tool that is used to distinguish or identify. Based on our research, we would like to suggest that all hiring agencies or personnel in Malaysia to liaise with clinical psychologists to administer the MMPI test during the first stage of the interview process as proposed by Cole 2021. Remember Richard Huckle? He was an English teacher and freelance photographer who traveled across the world, including Malaysia, and gained access to orphanages and schools, allowing him to manipulate vulnerable children aged between 6 months to 12 years old to become his sex slaves. As a layman, nobody would be able to tell that Huckle is a monstrous pedophile, and with his profession, he would definitely get easy access to children. With MMPI, it can help to avoid this atrocious case from happening. Another suggestion is, on top of the HIV and thalassemia tests that are made compulsory for couples planning to get married, MMPI should be made mandatory too. The result will help to proactively prevent any unwanted harm in a family institution, as highlighted in a study by Lee et al. 2019. It is crucial to note that MMPI is not a test to label and discriminate. Instead, it aims towards giving access to various support groups, treatment programs, and medications that might not have been available previously. Now that we have presented the theory and concept of MMPI, the real-world issue related to MMPI, backed with our recommendations and solutions, let's play a game to test your understanding. Please scan this QR code to join the game. Thank you.